pretty rural here. And we talk to patients about trying to eat healthier. And probably the number one reason that they give me that they have a hard time with that is because of the cost of groceries. And a lot of times people are on borderline where they can't qualify for food assistance. So we try and get them pantry help if possible. And sometimes that's not always healthy either. So I was really, really excited when we were selected for the Jumpstart. I would have people say that they were very thankful for the program. The one lady said she was able to buy like chicken in bulk and then, divvy it up and use it for later meals. So she was thankful for that because usually she couldn't afford to do those types of things. So they were very thankful. And they did say that they found some good tips and pointers on recipes too. And I did receive your weekly emails that you sent out, and they were very informative, and I found a lot of good information in there, and I'm glad that I got those so I can look back at them. They're so eye-catching too. I had a lady that was 10.6 and she got down to 7.1 after 3 or 4 months. And that always makes me really happy when I see that. And they're excited too. And it helped. I think having me show excitement as well helps them to stay on track.
When someone is facing barriers, especially around housing, but food too, it becomes very difficult. I know if you have to try to manage someone's diabetes and they're living out of a car, or they're having difficulties in terms of reliable access to a refrigerator, things can be pretty difficult. And as much as they may want to do well with their diabetes, sometimes these things fall more to the bottom of the list because they're just trying to survive. And she's really thought the program has helped. It's allowed her to have some dollars available for other necessary items. When she looks at the things that she considers necessary, she doesn't necessarily have to choose between them because she actually has some extra dollars for food. There's another, when she comes to the clinic, she needs $1 to get back on Dial-A-Ride to get home. So dollars are really tight for some of our patients. And so this not only has an educational value for them, but a real practical benefit for them in terms of caring for their diabetes. One thing I learned when I was studying to be a nurse practitioner, and it really was a profound experience and a helpful one, is, for clinicians, we often think about the patient in the exam room. There are a lot of factors that influence health that don't go on in an exam room. And that's the public health piece. When you're trying to provide care day in and day out, you're focused on the patient in front of you, which is important. Can they get to their appointments and all of those things? But it's easy to miss out on the fact that as a system, there might be things that we can do better. And that doesn't necessarily mean legislatively, but just tapping into the resources that exist, because we know that those are important things that influence their health.